Outside the brain, is outside the central nervous system. As a way of illustration, let me illustrate what happens during a convulsion. You know, the brain is a structure in the head that we know that controls the executive functions of the body. And the brain contains a lot of wires. Just imagine wires and wires and wires, you know, connected and tied together appropriately. And then it gives us lightning. It gives us a lot of things that we enjoy in our domestic life. So also a lot of wires are connected together in the brain. We call them neurons. And their connection helps us to be able to control different body functions in us. So if anything goes wrong along this connection, they are abnormally connected, or if they are fired up in a way that is unexpected by the body, it can also give rise to a spark, just like electrical wires will. And when that occurs, it can result in abnormal control or abnormal movement of the body parts that is being controlled by that part of the brain. And that then manifests as abnormal body movements. What that means is that if the part of the brain affected, for example, is the part that controls the function of the right hand, then what happens? Abnormal movement of the right hand occurs. If it's the part of the brain that controls the function of the movement of both legs, for example, abnormal movement of both legs occur. And that is exactly what happens in convulsion. As a way of reminder, I said that febrile seizure is seizure, convulsion that occurs due to elevated body temperature. It is not due to a primary disease within the brain or its coverings. I know what you're thinking. You're probably saying, yeah, so what causes it? It's not caused by a disease in the brain. So what causes it, doctor? The causes of febrile convulsion will actually be other causes of fever outside of the brain. And these include malaria. If you are living in malaria endemic region, you're in West Africa, Nigeria, countries in West Africa like Nigeria, it's one of the commonest causes is malaria. But like I said, in the previous video, malaria is not the only cause of fever. And therefore, other causes of fever like throat infection that we call tonsillitis, pharyngotonsillitis, is another common cause of febrile seizures. Measles is a cause of febrile seizures. Chest infection in children, lower respiratory tract infection like pneumonia can also result in febrile convulsion. All these conditions are things that can cause the body temperature to be very high. Urinary tract infection, if not recognized early, resulting in fever, high fever, can also cause febrile convulsion in children predisposed. In many of the children that have febrile convulsion, about a quarter of them, there is usually a family history of febrile seizures. And febrile seizures commonly occurs in children between 6 months and 5 years of age. It's been reported recently in children as low as 3 months and up to 5 years of age. What this statement means is that if a child outside of this age range is having seizures or convulsion, please don't be quick to conclude that this is febrile seizure. Please kindly go to a health facility. Let the child be seen by a trained health personnel, preferably a pediatrician, a pediatric neurologist, or any healthcare professional trained in the care of children who will recognize abnormalities and refer appropriately. Do not make that diagnosis yourself, mommy, caregiver, daddy, teacher. You are not a doctor and you are not a healthcare professional trained in the care of children. So please, in the setting of any convulsion outside of this age group, do not conclude that it is febrile convulsion. Even with this age group, if convulsion occurs, immediately after taking the appropriate first aid measures that I will be discussing with you shortly, please kindly take this child to the hospital. The reason is because if the cause of the fever is not appropriately treated, the fever will still recur. And if it does, then the convulsion can still occur. And like I illustrated earlier on, convulsion occurs when there is abnormal, spark between the neurons in the brain. With each convulsion, there is the potential tendency or the potential risk of damage to these neurons. Therefore, we lovers of children and young people do not like convulsion recurring and recurring and recurring. So if it occurs once, please kindly go to the hospital, let a trained healthcare professional decipher the cause, and let appropriate measures be taken to treat the underlying cause so that fever will be well controlled and the child will be well. Are we still on the same page? Yes. As you are listening to me, hit the subscribe button, like this video, and share with other caregivers. Thank you. Yeah, fantastic. I know you've done that. Yeah. So, is febrile convulsion itself dangerous? Immediately, I would say no. And the reason is because febrile convulsion on its own will resolve. Convulsions will run their course and they will resolve in majority of cases. What this means is that if a child is convulsing, your duty as a caregiver, as a bystander, as somebody in charge or nearby to the child at that time is to remove the child from danger, remove danger from the child, support the child, meaning lay the child on the left side of the body, as this will prevent the child aspirating anything. Do not put anything in the child's mouth. Don't put your hand, don't put spoon. All these are myths. The convulsion will run its course. Once the wires touch and the spark, ceases, the abnormal movements will also stop. So please kindly lay the child on the left side. Most times, the convulsion will resolve in less than a minute. And after this, you take the child to a health facility. If the child's temperature is still very high, you can tepid sponge as discussed in the earlier video, or give a dose of paracetamol, but that should not prevent you from taking the child to a health facility as soon as you can, so that appropriate assessment in form of questioning by the healthcare professional, appropriate examination, relevant tests can be done, and the cause of fever can be appropriately treated. Please do not give concussion to a child convulsing. Do not put anything in the mouth, as all this increases the risk of aspiration, and this then brings in complications that are not supposed to happen in a condition that is normally self-limiting. Are we together? Yeah, thank you. Just about 1% of children with febrile convulsion may go on to develop epilepsy, but this is not enough reason to stigmatize any child with febrile convulsion. Majority of them will outgrow it. So next time a child is convulsing, you now know the right first aid measures. Keep the child safe. Once the convulsion wears out, do something to bring down the fever and get to an health facility as soon as possible. Thank you for joining me on today's episode of Parenting Medical Guide. Let me know your thoughts in the comment section. Like this video, share it. Till we meet on another episode, I remain yours sincerely, Dr. Toluwani Babalola. Thank you. Bye.